Just want to take a minute to talk to you about hip bracing. There's several different types of hip braces that can be provided that are on the market today. One is called a swash, which is SWASH, which stands for standing, walking, and sitting hip orthosis. Those are great orthoses, and you can find more information on those online. This particular one that I wanted to show today is called a maple leaf hip orthosis, and this was first designed in Canada for use for patients after hip surgeries or in order to stabilize the hips and to set them into abduction. These orthoses have adjustable abduction, so we can set the angle of the hip at whatever angle we want to and then lock it into that position. They do allow for freedom into movement, into flexion and extension, so they can be used in standing or walking therapy as well, or sitting in a chair. Or we can set limits on those if need be, if it is a post-surgical situation and we want to immobilize the hip in a certain angle of abduction and an extension, for example. It can be totally locked into position there, or it can be free. The nice part about this is that it has more of a substantial trunk section, which comes further up onto the lower rib cage, as well as holding the pelvis. So anytime there's an asymmetrical tone in the hips pulling, typically a lot of times we see the legs being pulled inward into a scissoring pattern, kind of like this. And in order to adjust and compensate for that, we need to be able to hold the trunk in a straight line, in line with the pelvis, and then position the leg in relation to the trunk, so that it's not tipping one way or the other and overpowering the trunk and simply keeping the legs separated, but just moving them off to one side. We can keep in line with the trunk and then position each leg as need be.